Hey there, future doctors and medical detectives. Ever heard of a disease so rare it makes unicorns look common? We're about to dive into the world of a real medical head-scratcher, primary angiitis of the central nervous system, or PACNS for short. Because who has time for all those syllables? We're talking about a condition so sneaky it can mimic other illnesses, leaving even the best doctors wondering what's going on. But don't worry, we're going to break it down in a way that's easy to understand, even if you're not fluent in doctor speak. Get ready to explore the ins and outs of PACNS, from its mysterious causes to the challenges of diagnosis and treatment. By the end of this journey, you'll be well equipped to impress your friends with your newfound medical knowledge. So buckle up, grab your thinking caps, and let's unravel the enigma that is PACNS. Imagine your brain as a superpowered computer, constantly sending signals throughout your body. Now, picture those signals traveling through a network of tiny wires, or blood vessels. These vessels are super important because they deliver oxygen and nutrients to keep your brain running smoothly. Now enter PACNS, the party crasher. This condition throws a wrench in the works by causing inflammation or swelling in those crucial brain blood vessels. It's like throwing sand in the gears of your brain's intricate machinery. This inflammation can spell trouble because it messes with the blood flow to different parts of the brain. And when your brain doesn't get the oxygen and nutrients it needs, well, let's just say it's not a happy camper. Diagnosing PACNS is like trying to solve a medical mystery with only half the clues. It's a tricky business because its symptoms can look like a lot of other neurological conditions. Doctors have to put on their detective hats and use a variety of tools to crack the case. One of their trusty gadgets is the MRI machine, which takes detailed pictures of the brain, kind of like an X-ray on steroids. They might also perform a lumbar puncture, also known as a spinal tap, sounds scarier than it is, to analyze the fluids surrounding the brain and spinal cord. In some cases, doctors might even need to do a biopsy, which involves taking a tiny sample of brain tissue to examine under a microscope. It's like looking for clues under a magnifying glass, only way more high-tech. The bottom line is diagnosing PACNS requires a team of skilled medical professionals, a bit of detective work, and a whole lot of patience. Section 4. Red flags and warning bells. Symptoms of PACNS. Remember how we talked about PACNS messing with your brain's blood flow? Well, that disruption can lead to a whole bunch of strange and confusing symptoms. It's like your brain is trying to send you an SOS signal, but it's not always clear what it's trying to say. One of the most common symptoms is a real humdinger of a headache, the kind that makes you want to crawl into a dark room and hibernate. Other symptoms can include dizziness, vision problems, seizures, and even stroke-like symptoms, such as weakness or numbness on one side of the body. Now, here's the tricky part. These symptoms can come and go, making it even harder to pin down what's going on. It's like trying to catch a shadow, except this shadow can seriously mess with your health. Section 5. The bigger picture, epidemiology and survival. Let's zoom out for a second and look at the bigger picture of PACNS. Because it's so rare, figuring out exactly how many people are affected is like counting grains of sand on a beach. It's a tough job. What we do know is that PACNS affects people of all ages, races and ethnicities. It seems to strike adults more often than kids, but even then, it's still incredibly uncommon. The good news is that with early diagnosis and treatment, the outlook for people with PACNS has improved in recent years. Doctors use a combination of medications, such as steroids and immunosuppressants, to calm down that inflammation and prevent further damage to those precious brain blood vessels. While PACNS is undoubtedly a serious condition, it's important to remember that it's not a death sentence. With the right medical care, many people with PACNS can live full and active lives. So the next time you hear someone mention PACNS, you can confidently say, I know what that is. It's a rare brain condition that causes inflammation in the blood vessels, but with proper treatment, people can still thrive. You might even inspire someone to learn more about this fascinating and complex disease. Like, share, comment and subscribe.